Hello, Gary.
Hello, Mr. Young.
Do you know that we give first aid training to all new workers in the company?
Yes, I know.
During the training session today, we are going to discuss what to do in different emergency situations. Please listen very carefully, because it may help you save lives. A blocked airway can kill someone in less than 5 minutes, but it can take 10 minutes or more for an ambulance to arrive. In an emergency, quick and effective help can save the life of your colleague or your own life. In our first aid training, we learn the following. What is a cardiac arrest and how should we deal with it? What can we do to help someone breathe again normally and to fix their blood circulation? What is a heart massage? How to put a person in a recovery position. Do you know any of these terms?
Sorry, I don't know any of these terms.
These are important things one should know to save the life of injured people. You should provide the first aid until the paramedics or the ambulance arrives. It is very important to alert the paramedics or the ambulance as soon as possible. First aid could reduce the effects of injuries and also stabilise the injured person's condition. There are 4 basic steps you have to follow. The first step is to check if the person is unconscious and if he or she is breathing. Next, follow 3 simple rules. See, hear and feel. Speak to the person and see if he or she reacts and if he or she is breathing. If the person is unconscious and does not breathe normally, there is the risk of a cardiac arrest.
What should I do in case the victim is unconscious? How does the resuscitation work?
We will see this together now.
Kneel close to the victim. Put the heel of your hand on the lower part of the person's chest. Put the heel of your other hand on top of the first hand. You have to apply 30 chest compressions by compressing into the chest about 5 to 6 centimeters deep with the heels of both hands, keeping them stretched. Keep the rhythm of the presses to a maximum of 120 times per minute. Then, start with mouth-to-mouth respirations twice. First open the airways of the person. Gently tilt their head back by lifting the chin. Close the person's nose completely, then open their mouth, and whilst breathing normally, blow air into their mouth. Repeat this again. Then start with the 30 heart compressions, followed by 2 further mouth-to-mouth respirations. The resuscitation with heart massage and mouth-to-mouth respiration was the second step. Now we look at defibrillation. This equipment is available on some building sites. It tries to reinstate the normal heart rhythm using electric shock. You continue with the heart massage while another helper connects the patient to the device. The helper follows the instructions on the device. Do not touch the patient. Device is charging. Push shock button. Shock was delivered.
Now the third step. Continue with the resuscitation until the paramedics arrive or until the person regains consciousness and starts to breathe normally again.
How do we know if they have regained consciousness?
If they start coughing or open their eyes or they breathe again normally, then we should put them in the recovery position by turning them to their side and slightly opening their mouth.
I understand. And what is the 4th step?
The 4th step is to take the person to the hospital. For this, you have to wait for the ambulance. Do you have any more questions, Gary?
No more questions.
Many companies regularly carry out alarm and emergency drills. This helps them be better prepared for emergency situations.
Every year we carry out an alarm drill.
Can you give me more details?
Of course. We explain to you what to do in case of any emergency. You may hear an alarm ring at any time.
When will it take place?
I cannot tell you now. It could happen any time.
Perfect. I will do my best to be ready.
A few days later, Gary and Jack are working when they hear the emergency alarm sound.
This is the alarm sounding.
Yeah, we have to leave the construction site. Let's run.
Leave everything behind. Let's go downstairs.
Don't go downstairs. It's the basement. There's no exit.
It doesn't matter. Come on. Leave everything. We really have to leave now.
Tell Peter that we have to leave. He's wearing earplugs and probably can't hear the alarm.
Peter, the alarm is sounding. We need to leave.
He can't hear you. Let's go.
The next day, Mr. Young meets the new workers to talk about what happened during the emergency drill.
Let's talk about what happened yesterday during the emergency drill.
Okay, Mr. Young, we think that is important.
Gary, you did not follow the correct emergency procedure. When you heard the alarm sounding, you started to panic and ran. You didn't pay attention to the alarm.
I know. You're right.
And you didn't pay attention to the evacuation sign, so you went downstairs to the basement where there is no exit.
Sorry, I was afraid.
When the site manager counted everyone at the assembly point, they realised that 2 people were missing.
You're right.
You and Peter were the 2 missing workers. Peter, didn't you hear the alarm sounding?
I'm very sorry. I promise that will not happen again.
At the end of the working day, a worker is still working on a scaffold.
I have to leave work early today. I have informed the site manager. Jack, could you please clean the tools and put them back in the right place? Here, you can have my helmet.
Pay attention, Gary. There are workers still working above us. We should be careful. Something could fall down on us from above. Come, let's move away from here.
Oh!
Gary, you're bleeding. Can you hear me?
Please help me. My head hurts. Call the ambulance. I am bleeding.
Gary's head is bleeding a lot.
Gary, stay calm. We are going to help you. The site manager has already called the ambulance. Come, Jack. We have to move Gary away from this area.
The bandage stops the bleeding. Gary's head still hurts. The ambulance arrives and takes Gary to hospital.